Hey everybody, Luke Gordon, physical therapist, and I'm back with another video about shoulder pain. This video is all about shoulder impingement or shoulder impingement syndrome, depending on which term you have been told or have read online. And I want to explain what that is, and then we're going to use my lovely shoulder model here again, which I just used in a couple other videos to describe different topics related to supraspinatus and infraspinatus tendinosis. So again, today's video is all about what is shoulder impingement, what causes it, what does it look like, what's actually happening. So basically, the easiest way to think about shoulder impingement is that along the top of your shoulder, where I have this pink piece of K-tape, this is your supraspinatus muscle, which is the top muscle of your rotator cuff. Rotator cuff includes 4 different muscles. We have supraspinatus on top in pink, infraspinatus in blue, and we have 2 other ones that I really don't want to get into just because I don't want to confuse things. But again, this top muscle in pink, your supraspinatus, running along the top of your shoulder blade, it goes underneath these bones here. And this main bone here is called your acromion. Now, if you look at it anatomically, this is your shoulder blade here, and the acromion is like the very far end of your shoulder blade. If you wanted to palpate that and locate it on yourself, reach back, feel that bony crest along your shoulder blade back there, and just follow it all the way out towards the tip of your shoulder. And eventually you should be able to just kind of drop off of it, and you're going to drop off onto your humerus or your arm bone here, your upper arm bone. So that's where we're looking. So that supraspinatus muscle is traveling along the top of that crest here, and then it's ducking underneath your acromion here, and it's going to insert out here onto your humerus. So again, that's the pink tape on my shoulder model here. This is a right shoulder. This would be the front, and this would be the back. So as that supraspinatus muscle is going underneath the acromion, you could imagine yourself like lifting your arm and doing different movements. And what can happen underneath there is that your supraspinatus muscle can get pinched. It can get pinched underneath this bone here. Again, it's your acromion. So that's essentially what shoulder impingement syndrome is that when you do certain movements, common ones would be like lifting your arm to the side like a chicken wing. That one can really hurt. Or lifting it to the side and then twisting it, reaching behind your back like to tuck your shirt into your pants or tuck your wallet in, something like that. Reaching behind you to get something out of the backseat of your car. Those movements can really cause that supraspinatus muscle to be pinched by your acromion. And that's what you get with impingement. Another common one is like doing cross-body motions can cause that. So it's essentially just that pinching sensation, and it causes pain. Typically, you'll feel pain kind of where it's being pinched, but you're primarily going to feel pain down the outside of your shoulder, outside of the arm there. And again, so that's what impingement is kind of on the basic level. If you look at what causes impingement then, there's a few factors that can go into that. The most common cause of impingement that we see is really what we would call like an insidious onset, which there is no specific cause for it, or there's no specific injury, I should say. The cause is clear, but the injury is not. There's no specific injury. A lot of people just say, hey, I woke up with shoulder pain. It gradually worsened over the next several months, several years even. Now I can't lift my arm in certain positions. Now I can't sleep on my arm. Now I can't throw a ball, all these things. And that's when they end up looking for help. So what causes it can be simply rotator cuff weakness. So if you have weakness of the supraspinatus muscle, essentially that weakness will make it easier for the muscle to get pinched. Because as you're moving your arm in different motions, that top muscle, the supraspinatus again, is maintaining the space for it underneath the acromion, and if that doesn't do it anymore, it's going to get pinched more often. The other common cause, which it could be a combination of causes, is that you have a bone spur under there. So bone spurs grow sometimes in arthritic shoulders, and that bone spur sitting underneath the acromion, kind of like a stalactite hanging down from the top of a cave, is now like wearing into the rotator cuff muscle there. So that could be part of it. And then the other common cause is that you can have different shapes to your acromion. So some people's acromion is angled at different angles, and if it's angled down more, that can put more pressure directly onto that top rotator cuff muscle. So that's what shoulder impingement is. That's how it happens. If you get into like the treatment of it, you basically want to do everything you can to heal the rotator cuff muscle and then ultimately improve strength. So I'll probably make a separate video about that at some point in terms of, okay, You've got shoulder impingement syndrome. Now what do you do with it? So I'll make some more videos on those in the future. And then for now, if you have any questions or comments about that or about shoulder pain in general, just leave those below the video. And while you're here, if you would give me a like, I would appreciate it, and subscribe to my channel. So that's it for now. I'll be back, I'm sure, in a few days or a week or so with more videos to help you out. Thanks for watching.